Hello everyone. So I will be presenting one interesting case today. Clinical history. The patient, a 25-year-old male patient, presented to us with an old radiograph with having reports of Hallux Valgus deformity. He wanted to be an army recruit. However, he was rejected pertaining to the Hallux Valgus deformity of the great toe. He got few other radiographs done at the private centers, but all the radiographs were of non-weight-bearing nature. There was no other abnormality. He was referred to us by the orthopedic department for repeat radiograph. And the old investigations as I told, were the radiographs from different centers. So there was one radiograph he brought to us which was taken on 27th January 2022, which showed that there was a metatarsophalangeal joint angle of 20 degrees on the left and 16 degrees on the right. There was another non-weight-bearing radiograph done at a private center, which showed the metatarsophalangeal angle of 19.29 degrees on the left and 16.49 on the right. So the modality that was done here was weight-bearing radiograph of both feet, and the weight-bearing radiograph taken in AIIMS Bibinagar and metatarsophalangeal angles were calculated based on that, which were found to be 17 degrees on the right and 18.7 degrees on the left, so suggestive of bilateral Hallux Valgus deformity. So the final diagnosis that was kept by us was bilateral Hallux Valgus. So usually a normal first metatarsophalangeal angle is less than 15 degrees on AP weight-bearing foot radiograph, and anything greater indicates Hallux Valgus deformity, where the head of the first metatarsal is deviated medially. The intermetatarsal angle should be less than 9 degrees on any weight-bearing foot radiograph. This particular information has been taken from the reference as given below. So the salient features of the diagnosis from literature review are that Hallux valgus deformity, also known as bunion, is one of the most common forefoot deformities, and it manifests with the proximal phalanx deviating laterally and the first metatarsal head deviating medially. The precise etiology is not fully understood, but there are many proposed theories. Hallux valgus deformity is most likely a result of multiple contributing factors, including the genetics, short first metatarsal, dorsiflexed first metatarsal, flexible or rigid forefoot varus, rigid or flexible pes planovalgus. There could be multiple muscular or ligament abnormalities or joint hypermobility. Interestingly, certain arthritic conditions such as gouty arthritis, psoriatic arthritis, and research has also shown that rheumatoid arthritis predisposes patients to Hallux valgus deformity. Hallux valgus deformity is more commonly seen in connective tissue disorders such as Marfan's and Ehlers-Danlos syndrome, as well as can be associated with Downs. The pathophysiology of Hallux valgus is complex, but the general assumption is that the imbalance exists between the extrinsic and intrinsic muscles of the foot, with the involvement of the ligaments also. The maintenance of the first metatarsal alignment is by the tension created by the peroneus longus laterally and the abductor hallucis muscles medially. So collateral ligament also prevent movement along the transverse plane at the first metatarsophalangeal joint. So usually it is seen that all these muscle and ligament equilibrium gets distorted if there is Hallux valgus deformity, or could also contribute to it. So the radiological assessment of the Hallux valgus is done by measuring the metatarsophalangeal angle, and there are various angles that can be measured pertaining to the foot, but for Hallux valgus deformity, metatarsophalangeal angle is the must. There is one latest article in Skeletal Radiology which had interesting conclusion. The above article can be accessed on website with the digital object identification number as given above. And it had the conclusions of that the clinical decisions based on weight-bearing and non-weight-bearing radiographs vary significantly, and weight-bearing films are crucial for the assessment of Hallux valgus deformity. That's why we repeated the film in our institute with weight-bearing both feet. Repeating radiograph is justified in patients presenting with non-weight-bearing radiographs of symptomatic Hallux valgus. Also, it has been found that in early hallux valgus deformity, non-weight-bearing films tend to overestimate the deformity, while in advanced deformation, they tend to underestimate it. So that was an interesting fact from the above paper. Thank you very much.